going to do is walk in and perform hand hygiene. So I'm washing my hands. I'm going to walk over to the patient and introduce myself. Hi, I'm Hannah. I'm going to be RN. How are you?
I'm good. How are you?
Good. I want to start off this exam by verifying your information, okay? Can you say your name and your date of birth?
Melissa Smith, 05/07/2000.
Okay, and then Melissa, do you have any allergies?
Yeah.
What are your allergies?
Peanuts.
Peanuts? Okay, and what is your usual reaction to peanuts?
My throat usually closes up and I get like itchy and rashy.
Okay, awesome. Alright, so the first thing I'm going to do is take Melissa's heart rate. So I'm going to ask Melissa, can you lay out your hand like that? Thank you. And what I'm going to do is I'm going to count to 30 if her heart rate's regular, if it's a regular beat. If it's not, I'm going to count for a full minute. So I first have to deem if it's regular or irregular. And at the same time, I'm also going to be taking her heart rate or her respiratory rate, and I'm not going to tell her that, so. Alright, her heart rate was regular, so I counted for 30 seconds, and then you multiply by 2, so her heart rate's 80, which is good, it's in the range, and then her respiratory rate is 18, so she's breathing up and down, 18 breaths per minute. The next thing I want to do, since this is a neuro exam, I want to ask her some orientation questions. So, Melissa, who are you? What's your name?
Melissa.
Okay, and where are you?
I'm in the doctor's office.
Okay, and what time is it? Do you know what time it is?
Yeah, it's 11.
11 o'clock? Okay. And then, why are you here? Do you know why you're here?
Yes.
Okay, you're here for a neuro exam?
Yeah.
Yeah, okay. Alright, so everything's intact mentally, which is good. So the first cranial nerve I'm going to be inspecting is the cranial nerve 7, and that's her facial nerve. So this is where I'm just looking at her face for symmetry, making sure there's no abnormal discolorations or there's masses, drooping. Drooping can be a sign of a stroke. So I'm just inspecting. Yeah, everything looks good. Awesome. And then after that, I'm going to test cranial nerve 7. So I'm going to be asking the patient to do a ton of things. So the first thing I want you to do is smile, okay? Okay, and then show your teeth. Okay, and then raise your eyebrows. And then wrinkle your forehead. Okay, good. The next nerve that I'm going to be testing is cranial nerve 5. So this cranial nerve 5 accounts for motor and sensory function. So the first thing I'm going to do is motor. So I'm going to ask Melissa to clench her jaw, and I'm going to feel for the muscles. So, all right, clench. Clench. No, let go. Clench. Let go. Clench. Alright, and then I'm also going to be palpating the temporal artery just so I can feel that. Clench. Let go. Clench. Awesome. Okay, so that was the motor part. Now the sensory part. So I'm going to be using a cotton swab. I'm going to be using a soft part and a harder part. And I want to see if Melissa's going to be able to recognize which is which. I'm going to have you close your eyes. And I'm going to touch her 2 places on her forehead, her nose, both cheeks, and her chin. So first I want to see if you can feel this, okay? Yes. Yeah. Yeah. Okay, now I'm going to do the other side. Yeah. Yeah. Okay, and then now I'm going to do either one, and you're going to have to tell me if you think it's the soft part or if it's the hard part, okay?
Okay.
Alright.
Soft. Hard. 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 Soft. Soft.
Okay, now I'm going to be inspecting the lids, the conjunctiva, the sclera, and the cornea. Can you take your glasses off for me, please? Thank you. Alright, so I'm just looking, seeing if there's any foreign bodies, any cloudiness in the eyes. I'm going to pull the patient's lid down making sure that that conjunctiva is pink. Everything looks good. I don't see any foreign bodies or anything like that, so that's good. Alright, so for this next test, I'm testing the third cranial nerve, the fourth and the sixth, which is the oculomotor, the trochlear, and the abducens. And this is checking if there's any nystagmus in the eye. So I'm going to be, I was supposed to be using a pen light, but I don't have one, so I'm using her phone through the 6 cardinal fields of phase. The 6 cardinal fields of gaze. So can you stare at right here, okay? Now follow the pen light, okay? Don't move your head, just follow it. Okay, there's no nystagmus present, her eyes aren't shaking, anything like that, so that's good. Okay, now I'm going to be testing the corneal light reflex, so I'm going to ask Melissa to just stare, stare here, 15 feet away, and I'm just going to be using the flashlight to see if there's an uneven gaze. So just stare. Okay, yeah, there's no uneven gaze present. Now what I'm going to be doing is testing the pupillary light reaction, so making sure that both of her pupils are constricting when light is present. So I'm just going to also be using the phone for this. So just stare back there again, okay? Yep, they're both constricting, which is what should happen. Okay, yep, they're both constricting. Next I'm going to be looking for accommodation in the oculomotor nerve, so I'm just going to have her stare straight, okay? And I want you to follow this to your nose, okay? Okay, that's good. So then testing for visual acuity, unfortunately I do not have a sound chart, but what I would do is if I did have one, I would ask the patient to cover one eye and read the lowest amount of letters on the graph that they are able to, so the smallest amount. And then I would ask them to cover the other eye, do the same exact thing, and then let both eyes read the chart. Next, I'm going to be testing the cranial nerve 8, which is the vestio-cochlear, and this is the whisper test. So I'm going to stand behind the patient for this one, and I'm going to ask you to cover one of your ears. Okay, and then I want you to whisper, or I want you to tell me what I'm whispering to you, okay?
Okay. Cat, dog.
Okay, and then the other one?
Blue, red.
Awesome. Okay. Next, I'm going to be testing nerves 9 and 10. So this is with her mouth. So what I would do is I would ask the patient to open her mouth. You open your mouth. And can you see, stick your tongue out a little bit. And can you say ah? One more time. Okay, so what's supposed to happen is the uvula and the soft palate are supposed to move up medially, and that's exactly what happened. So that's good. And then I could test the gag flex if I wanted to, but I unfortunately don't have something to stick down her throat. So the cranial nerves 9 and 10 were the vagus nerve and the glossopharyngeal. And the vagus nerve is intact because there's no hoarseness when she talks. She's able to talk clearly, so yeah. Okay, the next thing I'm going to do is inspect the hypoglossal nerve, which is number 12. So what I'm going to do for this is just ask the patient to stick out her tongue and move it side to side. And what I'm looking for is any abnormal fissures, any discoloration, any masses, bleeding, anything like that. Can you stick out your tongue? Farther. Okay. There's no abnormal fissures. The tongue is pink and moist, so yeah. Alright, next I'm just going to check for strength within the shoulders. So I'm going to put my hands on the patient's shoulders and ask her to shrug up against my resistance. So go ahead. Okay, awesome. The strength was a 5+. It was equal bilaterally, so she has full strength of both of those shoulders. Now I'm going to ask the patient to squeeze my fingers, and this is just checking for the strength within the hands. So can you squeeze my fingers? Okay, so they're in this one too? Okay, and they're both. Awesome, okay. So the strength is 5+, it's equally bilaterally across both of her hands. Okay, lastly, I'm going to check her strength on her lower legs or lower extremities. So I'm going to put my hands on her shins and ask her to push her legs up. Okay, awesome. Alright, so strength was also a 5+ grade, and it was bilaterally. Do you have any questions or concerns?
No. No? Good, thank you.
Okay, alright, well, it was nice to meet you.
You too.